Sorry, Janice.
Possibly ring, bark, or make noise away.
Yes, is Bob there? Reitman? I'm sorry. Bye-bye. Maybe I don't know it.
All right, so we are live streaming.
Okay, thank you.
Janet, do you want me to run and get my phone and see if I've got something in there?
Yeah, I don't have him on.
I'll be right back.
I also have a phone number for Bob.
Okay, I'm trying Beth.
Okay.
Oh, Beth went to voicemail. Well, Janice, what we'll do is we'll see what questions Ann has, and then Tom, if you want to try to call, could you try to call Bob from there?
Sure.
That would be great.
And I'm surprised because Beth had confirmed.
I know, and I just tried her and it went straight to voicemail, so I don't know if.
I appreciate the chart. This is great. I'm a visual learner and it helps me.
Do you have questions for Janice? Maybe we can have her answer any questions and then she can sign off if she needs to.
My main question, Janice, is because you understand this and live, eat, and breathe this. After looking at your spreadsheet, it looks to me like renewing the Aetna is probably the best for our employees.
Can you hear me okay?
You're a little bit quiet.
Okay, let me just see if I can. Is this better?
Can you hear Ann?
It's hard, it's difficult to hear.
Okay, I've got it turned up. I'm not on mute. And you could hear me okay before.
I'm not sure what device you're using for where your microphone is.
Well, it's built in. Let me try this. Can you hear me any better now? Not so
I can't hear you at all.
Let me. When you put me on live stream, did you mute me for any reason?
No,
I can hear you now.
Okay, Ann, can you hear me?
I can hear you.
Okay, I'll just talk very loudly.
Thank you.
Okay. In regards to your question, Ann, what we've done is we've gone to a number of different carriers to get rates. Some of the plans that are marked MIWA or COSI were underwritten rates, meaning that the group completed form fire, which is providing medical history to get rates for these non-ACA plans, because sometimes you can get better rates. The problem with the MIWAs and the COSI plan, or the networks and the formularies, can be more restrictive because they're trying to keep the costs down. Based on the current environment with COVID, I would say that 99% of our groups are staying put because of the emotions that are involved with switching health carriers in the middle of this terrible pandemic Most of our plans, unless they are hit with a double-digit increase, they are staying put. When we are looking at your specific plan, the Aetna plan, the biggest component there is, well, we know that the network works very well. We know that the formulary works exceptionally well. And the out-of-pocket maximum, when you compare it to any other plan that we have gone to, is substantially less to the employee. So the financial aspect is that they are going to get better coverage to stay where we are. The other thing to keep in mind is that with renewing with Aetna, what they're considering an early renewal, letting them know today, is that we will be able to get a pretty substantial premium credit that will appear in the
January invoice.
January invoice, where we're talking a substantial amount of money, about $13,000 they quoted as a premium credit, which certainly you wouldn't be able to get with any of the other carriers. So yes, my recommendation right now, as it stands right now, is to renew the Aetna plan and keep the good benefits, get the premium credit. And quite honestly, we could look again in June to see if it's worthwhile to make a mid-year plan change. So I would not say never, but I think at the current time, it's to everybody's advantage to renew with Aetna. And again, we can revisit this in June or July when things hopefully are looking better. We will have time to look at the networks closer because again, my concern is that they are using a narrow network that might not fit as well, and that creates a lot of angst and problems for people in different communities that don't have the same networks with some of these other carriers.
I believe that was our take, and in emailing with Beth, she felt that, I think if the numbers are right, that it was about a 3% increase, but that then the premium credit brought us back in line with what we've been paying in the past.
Right. The other thing is that if I can twist somebody's arm enough and guilt them enough, I might be able to get this reduced a little bit more. But I'm not sure if I can do that. But my my intent is to try to make someone feel really bad and get them to change to a flat increase. Well, sometimes it works. You know, I'm not not above trying to get somebody to give us a little bit more. But the increase was a pretty good renewal.
I think it was 2%, 2.5%.
It was 2.5%. And again, the benefit of this plan really is the network, the formulary, and certainly that out-of-pocket maximum right there in a nutshell.
Okay, I agree. I thought it was interesting what they raised some of the deductibles on in a year of COVID, to raise the deductible on, outpatient mental health. I thought was a little bit of dirty pool, but anyway.
Well, a lot of the carriers are approaching things differently. A lot of them, the mental health aspect is really important, and we see an uptick in that. Some of the carriers are changing the telemedicine. Aetna, I don't believe they've done this yet, but some of them are changing their telemedicine so that mental health providers in a network specific to the carrier are using that as well. So people that are at home that are experiencing issues because they've been stuck at home, they have the ability to call somebody. We don't have enough history to be able to tell you if it's working, but if it does work, I can see that being something that the carriers will all try to fall in line with, because number one, if they can get their own network of telemedicine or psychologists and psychiatrists, it will be a lot less expensive than someone going out and trying to visit with somebody. I know those healthcare professionals are very expensive, especially if they're not in network. it's
Right.
just a fortune. So I can see things headed in that direction in the future.
Yeah, it was the mental health and the, addiction part that I think probably they're seeing more of.
Oh, I agree completely. I think that everybody is being affected in different ways and negatively in different ways. It's very hard for some people to be able to stay at home and not see people on a day-to-day basis. So it's territory we haven't had to experience before.
I just emailed Beth, but how should I proceed, Janet, since we're half of the committee?
Well, I think, if we don't have any other questions for Janice, certainly you and I can let her go. I just thought it would be good for you to hear from Janice because I'm an employee and I am on the plan. So
Right.
I think it's good that you hear it straight from, the person that I've been working with so that, it's not just my opinion you're hearing.
Right. That's
And
good.
Janice has worked really hard on this and worked really hard for us. So I think it's good that you could at least have a conversation with her and not just me.
And I was having difficulty hearing when you answered when Janet asked if she got that paperwork to you this afternoon. That's in enough time for the premium credit?
I would want to have it as soon as possible because people are in and out of the Aetna offices, and I want to make sure that it ends up in somebody's hands today, so they don't have any reason to say that we weren't in there in a timely manner. So
Right.
I would say that it's 1 o'clock now. If you can make a decision, is 2 o'clock pushing it too much?
No.
Okay.
Okay.
All
And
right.
again, you know what? At any point down the road, we can revisit this again. I wouldn't do it until we got to like May or June to do that. But I mean, we can always look at it again if that's what the board wants to do.
Are you saying May or June with the idea that COVID will be less of an issue, or
Yeah.
May or June just as far as when's a good time to deal with the different?
No,
Perfect.
I'm thinking that maybe by that point things would have gotten a little bit better in terms of the pandemic. Because right now everybody is in such an uproar about everything that it's hard to move people in the midst of the pandemic. We can just reopen it. I mean, I want you to know that things aren't necessarily carved in stone. We can always revisit this, just maybe at a better time.
Okay.
But in terms of the benefits that you're seeing, that's not good. So if these are the benefits that everybody feels good about, that's not going to change, and we should be locked in. We can stay with Aetna for a full another year before that has to be revisited. I'm just saying, just in general terms, if you did want to look at more in detail, we could always do that later.
What about dental, Janice? Do we have to do anything with the dental?
I haven't, to be perfectly honest with you, the health insurance was my priority.
I got it.
And we can revisit the dental and I will in the next week. I've got a number
Okay.
that are sitting there.
Perfect.
I think our findings are going to be about the same, but again, that was given a backseat because the health insurance.
Right. Well, and I know the dental was a no increase as well. So, but I just want to make sure I wasn't forgetting to do something.
And we'll revisit.
Where's my head?
The most important part is when I narrow it down to a carriers that have rates that are better than or equal to what the current carrier is, then what we'll need to do is we will need to check the network, because that's the biggest issue with dental carriers, is that people almost never want to change their dentist.
Yeah.
And if the dentist is non-network, then it creates a financial hardship for them at that point. So we'll be very careful about that. But I wanted to take care of the most important part first.
Okay. Well, I'll be in touch with you real shortly then.
Okay, sounds great. It was very nice meeting with all of you, and take care.
You too. Nice to put a face with a name.
Yeah. Thank you,
Thanks.
Janice.
What'd you find out, Tom?
Well, I left a voicemail for Bob, you know, that the meeting was going on.
Okay,
As far as YouTube, I'm the only one watching it.
okay.
I guess not compelling TV.
No.
But
That's fine with me. It's fine with me.
People
We've been
want
streaming
upbeat, they don't want insurance.
Yeah. Well, Anne, what do you think? Do you want to have a quick conversation with Tim or Karen prior to me sending this signed form over?
How about if I do give Tim a quick call, if I can catch him and just explain where we are
Right, and then call me.
and then I will call you. Do I have your number where you are? Let me just make sure I've got the.
I can text it to you if you don't have me in your phone.
Say it out loud.
Yeah, I'm not saying it out loud.
Yeah, no, if you would. I was not gonna, I would have talked over you. Don't worry. You wouldn't have done it.
Yeah, that's you in
That would
my
be great. And speaking with Tim, I think is a good idea. And
Yeah, just because we don't have time to wait for the council meeting and,
no,
okay,
I'm comfortable with this, and I'm comfortable that Janice has done the research and given us as much information as we're going to have. So I see no reason not to sign up and take advantage of the
well,
premium.
and that's one of the reasons I wanted you to be able to speak directly with her and to have that outside input versus it just coming from me this time.
Right. No, I think that's great. I emailed Beth, but obviously if not,
And she's calling me right now, so,
you want to, will you confirm that she liked Aetna?
yeah. Beth? That's okay. Ann and I are just wrapping up. She's gonna call, you did like the current Aetna plan, correct? Okay, okay. It's okay. She's gonna call, we're still on YouTube, so she's going to call Tim Reynolds as the treasurer and go over everything with him. And if we're all on board, then I will get the signed form over to our agent to go with the renewal with Aetna. Okay? Yes. I'm feeling well. Thank you. I'm getting there. I'll check in with you shortly. Yes. Right. I agree. And so does our agent. I actually had our agent on the meeting, and, you know, she pointed out that the formulary works very well. The network works very well for our people, and the out-of-pocket expenses are, you know, this is the plan that has the best of that. And it's also a very emotional and stressful time to change plans for people. So yes, agreed. Okay, talk to you soon. Bye. She just completely forgot. So
Okay. Well,
anyway, so I think that's where we are. I think we're good. And you just give
that's the majority of our
talk to
community.
Tim, and then I can send the signed form over to Janice and move us along.
That sounds great. I'll try Tim right now. And but
Okay.
that's 3 out of 4 of us feel that that's the way to go. So I'm comfortable with that.
I am
And
too.
they can go on the website and watch the YouTube video and listen to every part of the
Everything
conversation,
that Janice said, yeah.
you know. So if they want to do that, you could make that available.
Yeah, we could even let council know. Yeah,
Okay.
very good.
Well,
Thank
thank you
you.
for asking Janice to join us. Thank you for setting this up, Tom.
Thank you, Tom.
Oh, you're welcome.
All right, I'll talk to you shortly then. Let me know.
Everyone take care.
You too. Thanks,
Thanks.
Tom. So Tom, I guess
Yes.
I'll talk to you after we're done. I'll give you,
Okay. You want me to just turn off the live stream, or
Please.
do you want to just call me?
I think we're adjourned.
Well, we are.
Yeah, turn off